Looks
Thanks
good.
so much for the introduction, and actually for the opportunity to speak to everybody today. And thank you all for coming. As Philip mentioned, some of my more recent work has really delved into this area of wastewater-based epidemiology. And so using wastewater surveillance as a public health tool for community well-being is sort of the topic of focus here today. I'm going to do something a little bit different than a standard research seminar. So I thought what I would do is really define what wastewater-based epidemiology is for those of you that may not be that familiar with it, and then really just go through a couple of different applications of how we're using this as a public health tool. So to start with, wastewater-based epidemiology is really a framework, and it works in the following way. It's meant to determine the consumption of or exposure to chemicals or pathogens, whatever your target is of choice in a given and defined population. So the way that it works is as follows. You have a community of individuals, and that those individuals are going to excrete molecules that then enter into a sewer network. We are able to sample in different areas within that sewer network. And then using various technologies, we're able to detect and in many cases quantify the amount of chemicals or pathogens that have been excreted into that wastewater sample. We then do analysis and disseminate data to end users. And then the hope is that this whole process is circular, right? And that we're providing information that can be used for some sort of action or intervention that actually helps the health or deals with health prevention in a given community. So that's sort of the overall framework of how this process works. So what are the benefits of wastewater-based epidemiology, and why are people interested in using this as a public health tool for community health? One is that it is rapid. So in many cases, we can actually measure analytes like SARS-CoV-2, like opioids. We can do that rapidly. And so we consider that to be close to real time. And in that way, it really gives you a snapshot of what's going on in a community in that given instant. So in that way, it can serve as an early warning tool of what might be coming with respect to community health related to the analytes that you're looking at. It's considered fairly sensitive. So a lot of the technologies, and I'll talk a little bit about this later, that we use to measure different molecules like PCR or mass spectroscopy are pretty sensitive methods. We're doing this at population level, right? So if we are taking a wastewater sample that represents a catchment area of 1 million people, it's giving us a snapshot of what's going on within that 1 million person level community. And so therefore it doesn't involve direct interaction of people. And at the moment, we're not actually required to get any sort of IRB approved to be able to do this work. The other point I want to make, and I'll give several examples of this throughout the talk today, is about the granularity of sampling. And so in that way, it can be used for broad community assessment. So looking at a sample from a wastewater treatment that represents a large catchment area of a population, or you can start going down to sub-levels of that, where maybe you're sampling from multiple wastewater treatment plants within a given county or a community. Or you can actually get down to a building level. And I'll talk about some of our campus surveillance we did for SARS that's related to what I'm considering here pretty granular level sampling. So I'm going to walk through sort of 3 case surveillance studies. The first 2 we've made pretty good headway on, and the last one related to agricultural communities, we're sort of just getting started with, but I'm going to touch on that one just a little bit. So the first one will be a story about SARS-CoV-2, so doing surveillance for that virus in a small coastal community in Florida. The second example is going to be large city surveillance of opioids, namely fentanyl, in 4 cities in the United States. And then I'll wrap up with talking about some pesticide work we're doing in a rural community in Florida. So we got started with this idea of wastewater-based epidemiology during the pandemic. So very early during the pandemic, myself and many others in collaboration with the Emerging Pathogens Institute here at University of Florida were tasked with building a high-capacity COVID-19 testing lab. And we built this lab in 10 days and I think processed 8,000 or 9,000 nasal or saliva samples. And so we're all very familiar with this, right? We all would get our nasal swab or we'd spit in tubes, and then those samples were processed using polymerase chain reaction, so a PCR-based assay that detects the viral nucleic acids of the SARS virus. And then individuals would get a result that was either positive or negative. And so we really started in that space. But then we soon realized that this technology could be applied to wastewater as well in order to try and track trends of the virus within communities. And it works because of the following reasons. We know that SARS-CoV-2 is shed primarily through feces. So sort of back to that model of wastewater-based epidemiology, we have individuals that are going to shed these molecules into wastewater streams. And we also know that fecal shedding of SARS-CoV-2 can precede some of the symptoms you might see when you get sick from COVID-19. And so therefore, wastewater tracking could provide early warning that cases might be increasing within a community. It can also then inform on where and when transmission is likely occurring. So if we're doing this in a given community that's defined, and then we have different wastewater treatment plans for different communities, we could sort of look across these communities and see where and when is transmission occurring, and potentially identifying hotspots within communities as well. And then the last point I want to make here is that in addition to sort of tracking the virus by this PCR-based method, we were also able to do larger scale sequencing, genetic sequencing of viruses that allowed us to identify variants as they moved through communities as well. And so we were not the only ones doing this. Actually, wastewater-based epidemiology, this has been a technique that's been applied for a number of years for other things, including polio. It got a lot of attention during SARS because it was found to be a very useful approach. And so really across the world, different groups were tracking SARS-CoV-2 in wastewater systems. And they are still doing it. So what happened as a result of a lot of that work is the CDC now actually has a wastewater SARS-CoV-2 surveillance system and a dashboard where there's information that's being input on wastewater levels of SARS from different areas around the country. Here's just a snapshot I pulled on Florida. So you can see all of these blue dots are regions of Florida that are submitting wastewater data to this national dashboard. And it attempts to give updated information on what the SARS levels are doing over time. So here's just a snapshot of January 2023 of this year through May, and you can see that the levels of SARS in wastewater are continuing to decrease, which is really not unexpected based on where we are in the pandemic. But really still now, and at the time that we were doing this, a few studies had examined the effectiveness of wastewater-based epidemiology and the application of this approach to small rural communities with population sizes that are less than, let's say, about 50,000 people. So we embarked on a partnership with Cedar Key, and this was now back in 2020. And so Cedar Key is in Levy County. It's on the Gulf Coast of Florida. It's a series of small islands that's about 2 square miles. And the resident population is about 750. So really small population in this region. What's sort of interesting about it is it has a large transient tourist population that visits the island year-round, second to commercial fishing that occurs there. This entire city is serviced by one single wastewater treatment plant known as the Cedar Key Water and Sewer District, which is shown by this. I don't know if you can see my cursor, but there's a red star on the inset here, and that's actually where the wastewater treatment plant is located in Cedar Key. So we really had a lot of community support for this study, and the objectives were as follows. So we wanted to examine the use of wastewater-based monitoring for SARS to track for the presence of the virus, introduction of virus variants, and to assess the influence of tourists on infection trends in this coastal community. And the idea was as if wastewater-based epidemiology could be used to effectively monitor the presence of SARS-CoV-2 in smaller communities, it would help officials in rural areas direct public health resources that are often limited in these type of settings. And furthermore, it would then help city leaders make educated decisions regarding commerce, tourism, and precautions as the pandemic was ongoing. So for this study, we actually collected wastewater samples weekly between May 1st, 2020 and April 30th, 2021, so about a year, directly from the influent of the Cedar Key wastewater treatment plant. So we had about 52 samples in total for this study. And then we performed the polymerase chain reaction for the SARS-CoV-2 to detect the nucleic acids. And then we also did some larger scale sequencing to try to see if we could determine whether genetic variants were present over time. We also were able to acquire daily visitor logs from the Chamber of Commerce to serve as a proxy indicator for the weekly number of tourists to the city of Cedar Key. And then we did some more extensive analysis, and I'm not going to share all of that considered certain covariates. And one in particular was the state level vaccination data to try to account for changes in vaccination rates among Florida resident visitors to Cedar Key. And so I'm just going to show you some summarized data that came out of this study. 'Almost 30% of the samples that we tested across the year were positive, and most of those yielded quantifiable results. So the way that we like to present the results for SARS-CoV-2 is in genomic copies. And so that's how the data is presented here. Just to orient you with this graph, so the bars are actually when we had hits for the SARS-CoV-2 by PCR in the wastewater. And then the circles are the number of visitors based on how we collected that data through the Chamber of Commerce over the entire time period. So there's a couple of things I'll point out here. First, at the beginning of May, I think it was right around Memorial Day, up until that point, the city of Cedar Key was only allowing residents. There's only one way onto that island. And so they actually had someone monitoring who was coming on and off the island. So they actually lifted that right here at the very beginning. And you can see that the number of visitors then started to increase. And then we started to see some more hits of the SARS-CoV-2 in wastewater. Up until that point, up until about August, there were only 4 cases that were actually confirmed on the island up until that point. Then we saw a pretty steady rate of visitors until about February, where we saw a pretty large uptick. And that was sort of around the time where everybody started getting back out and moving around in communities. And what was also interesting was that was when we saw our highest cluster of positive hits in wastewater for the SARS virus. The last point I'll make is that right after this last time point where we see an increase in March, we actually see a decrease of the presence in wastewater, and that corresponded to the rollout of the vaccine for, at least at that time, people over 40. So when you actually do a lot of statistical analyses on all these data, what we can conclude is that weekly tourism levels were positively associated with SARS-CoV-2 measurements in wastewater, and we were able to determine that for every 100 weekly visitors to the Cedar Key Chamber of Commerce, that we had a concentration increase of about 1 log 10 of genomic copies in wastewater. So we saw some really nice correlations there. And it really sort of solidified to us the fact that we could actually do this in a small rural community. We also were able to sequence some of the samples for variants, not all. So during the pandemic, we heard a lot about Delta variant, then there was the Omicron variant and so forth. And I'm not going to spend too much time here on this slide, but basically on the right-hand side, what I'm showing here is a cladogram that basically lines up different variants as they were sequenced, and this shows how they're compared to each other. So the closer they are to each other, the more related they are. The Wuhan 1 strain is what we're calling our reference strain, which was the first reference strain that was put together for the SARS-CoV-2 virus. These viruses tend to mutate over time, and then those are associated with different levels of sickness, if you will, when they infect people. We were able to identify 2 variants, and I'm pointing out on this graph in time where they were. One we found in August, and the other we found later in January. And they were interesting because they were different. They were definitely distinct from the Wuhan reference strain. And what we knew about UF40 was that it originated in Italy and spread throughout the US early during the pandemic. So it took a little while for it to actually be seen in Cedar Key. But right after that, there were a lot of infection control measures put into place. And we think that's why we didn't see it circulated further on in time when we sequenced samples past August for that specific variant. UF39 was interesting because it was a strain that was more closely related to one of the variants in UK. And so we're speculating that that was actually brought into Cedar Key through some of the visitors to that region. So again, sort of showcasing that we can actually track SARS-CoV-2 in wastewater, but we can also in some way be able to look at variants and how those are changing within a population as well. And so how did these data help Cedar Key? It allowed us to work closely with the city to promptly provide interpretations of the data. This was a really important aspect that we learned about the wastewater-based framework in general, is that providing data in a way that's understandable to city officials really helped them to be able to make quick decisions about what to do with the community, whether that was to keep people from coming on the island, whether it was to open that up, whether that was to try to implement mask wearing or not, and so forth. They reviewed weekly data at the city commission meetings, and importantly then disseminated this on a social media site to the residents. And so it really created a lot of trust with the residents. And so they actually saw that this was something that was helpful to their community. While the city initially closed their roads to visitors, this information was also really helpful in deciding when to actually reopen the city to visitors. So overall, it really worked well. And again, we met our goal of really trying to understand how well this could work in a city that was smaller and in a more rural area. We also did some SARS tracking in campus wastewater, and I'm not going to spend too much time on this study in lieu of time today, but I do want to bring it up for one reason in particular, and that is because this is an example of how we can do more granular sampling. So compared to sampling at a wastewater treatment plant, which represents an entire catchment area. So for example, in Cedar Key, it represented all of the 750 people plus visitors moving in and out of that community. Here's an example of where we were actually able to take samples from sewer lines and manholes on the UF campus during the pandemic that were associated with specific residence halls. So now we're looking at populations that are quite a bit smaller. We're looking at 100 to 300 people. And that really was a good approach for us to be able to implement more targeted interventions related to the pandemic and community safety. So this was a study, just briefly, where we became integrated into the screen, test, and protect efforts, which was sort of the program on the UF campus that was, charged with doing all the contact tracing and trying to reduce transmission among campus faculty, staff, and students. The way that this worked is that we would take samples from these wastewater sites. We'll explain more in detail in just a minute. We would do the same sort of detection of PCR, rapid turnaround of 24 hours. And then if there were positive hits, then the screen, test, and protect program would actually send text messages to residents in a given building, asking if they would go get testing and letting them know that some people might be positive in their building. The way that this works is we had to partner with the wastewater folks who gave us these sewage maps of campus. And what this is just meant to show you is, so this is the main campus at University of Florida, or a piece of it actually. And all of these dots are manholes and places that we can access the sewer systems. So we worked with them extensively to be able to utilize manholes that would give us information about very specific residence halls. And so what we ended up with was 28 different locations that we would sample weekly that really allowed us to cover about 85% of campus residents. And we would sample these once a week. So these are just some pictures showing our students out there weekly for a long time, a year, obtaining wastewater samples from sewer networks. And so that's sort of what that process looked like. Again, I'm not going to spend too much time on the data. Here's some of it here where we have the wastewater levels in the fall semester, which is on the left, and then the spring semester, which is on the right. And you can see that the levels sort of ebb and flow. And what you can do with some of these trends is you can start trying to overlay different things that were going on in the community, to try to identify maybe what was causing some of the peaks. So for example, where you see letter A for the fall semester in September. So this is when a lot of students actually returned. It was also when restaurants and bars reopened. And then shortly after that, we actually would see an increase in the wastewater levels of SARS. And then for the panel in the spring semester on the right, you can see when vaccines became available, and then you can see a decline in what we're seeing with respect to wastewater levels following that. I will say for the spring semester, it's with some of our highest levels, and they continued from January all the way through to the end of February, we feel were attributed to students leaving campus and being out at home or wherever they went to and coming back and potentially, bringing back infections that way. And so we did see some circulating virus for quite a bit of time at the beginning of the spring semester. Again, through a bunch of statistical analysis, we did show that there was a linear association between the virus wastewater concentrations and COVID-19 clinical cases that we were able to document on campus. So again, that's just an example of a more granular study. So moving from looking at entire community to subsets of the community, in that case, residence halls. So for most of the rest of the talk, I'm going to switch gears here to talk about another application of wastewater-based epidemiology. The framework is the same, but what I'm changing here is the analyte or the target that we're interested in measuring. And in this case, we're looking at opioids. It's going to be another example of looking at larger communities, but much, much larger communities, because we are looking at some major US cities here that have populations in the multi-millions. So we got started on this as part of INDUS, which is the National Drug and Early Warning System. It's a coordinating center that is funded by NIDA through NIH, and it is led by Linda Kotler. But what it does is it really serves as a hub to try to collate data related to the opioid epidemic that is ongoing, as a means to try to harmonize data and get a better sense of what's going on in these communities so we could better provide intervention and prevention measures. The coordinating center has 18, I think there's some more now actually, what we call sentinel sites or partner cities that are feeding data into the INDUS center. And you'll notice here, sort of to the right of the light bulb looking structure there's something called novel surveillance. And so when INDUS first was funded in April of 2020, there were a lot of novel surveillance approaches that were ongoing, such as rapid street reporting, hotspot reporting, real-time 911 dispatch data, so trying to get information on that. And all of that was related to either obtaining data from other types of sources on what's going on in a community, but primarily related to sort of the health side of things, from clinics and mortality, toxicology profiles, and so forth. So about a year and a half ago, we were fortunate enough to win a supplement to add wastewater-based epidemiology for surveillance of fentanyl and other opioids. And so we are now added as part of that novel surveillance arm of INDUS. And so there's certainly a need for this. I probably don't need to tell this group that, the opioid epidemic it's a crisis, really. I think there's about 100,000 people dying each year, primarily from fentanyl overdoses. And there's almost 1 million people that have died in the past 2 decades. Fentanyl is a tricky one. It's a synthetic, and it is consumed both knowingly and unknowingly because it's cut into a lot of other drugs to increase the effect of those. So in our pilot study, our objective was to coordinate collection and analysis of wastewater samples from partner cities for known drugs and metabolites, fentanyl and norfentanyl, and also emerging drugs, which I'm really not going to have time to talk about today. But secondly, we then wanted to start trying to validate these wastewater results with health data sets and then be able to disseminate this data to stakeholders. And so here's part of our study design. So we actually received samples once per week for 9 months from October 2021 to July 2022 from 3 large US cities and 1 small city, so 4 cities that we partnered with. 2 of those cities actually had 3 separate wastewater treatment plants. And so that allowed us to look at different areas or regions within a given city. And so we would send out these coolers and they would be returned with about 1 liter of wastewater on ice, and then we would process those. The processing here is a little bit different. So we're not using PCR because we're interested in looking for chemicals here. So we did a lot of filtering and extracting of the samples. And then we developed methods to look for fentanyl and norfentanyl, which is the metabolite of fentanyl, using mass spec based methodology. So this is more of a chemistry based approach. And this is what the data looks like from this type of analysis. The first thing I want to point out is fentanyl, drugs in general, when you're measuring them in wastewater, tend to be reported as consumption rate. And what I mean by that is how many milligrams per day per 1,000 people is being consumed. So that's what I mean when I'm talking about fentanyl average consumption rate. And most of the data I'll show you is presented in that way. So this is just a subset of data for one of the large US cities, just so we can all sort of get on the same page here. So what these numbers are the total amounts of fentanyl in nanograms per liter, the average of that over the 9-month period of time. So for fentanyl, it was 10 nanograms per liter. For the metabolite, it was 34 nanograms per liter. And then the average consumption rate then was 61 milligrams per day per 1,000 people. The consumption rate also takes into account the population of interest, the influent flow rate from the wastewater treatment plant, and the excretion rate of the compound that you're measuring. So the consumption rate is really sort of a way for us to normalize the data with these parameters. So if you compare the total amount of consumption rate 61, and then you look at the north, central, and south regions, because we were able to break these out because we have samples from 3 distinct wastewater treatment plants, you can see that they vary pretty widely. So certainly in the central region, you're seeing very high levels comparably, 114 for the average consumption rate compared to the north areas of the city and the south areas of the city. So breaking the city up is important in helping to understand where we're seeing the most activity related to, in this case, fentanyl consumption rate. And then you can sort of take all of that data and start to look at temporal trends in cities over time. So here I'm just showing you what the trends look like in cities 1, 2, 3 collectively, and then the small city for the entire 9 months of sampling. Again, this is graphed as average consumption rate. And what you'll just notice by eye is that the trends are different. So they differ between cities. The second thing I want to point out is that the scales are different. So for the large cities 1 and 2 and 3, the scales go up to 250 versus the small city where it only goes up to 20. So comparably, we're seeing a lot less in the small city, which is probably not unexpected. The last thing I'll have you notice is that in these large city 1 and 2, there are error bars because I'm combining all of the 3 separate regions here, but you can also break those regions out and start to look at those over time. And so for large city 1, for example, we have a total population of 4.6 million, but when you break them out into the regions, north, central, and south, you're looking at 1 to 2 million people in those regions respectively. And then this graph really shows that for some points in time, like in this March, or it's kind of in the middle of the graph, that we're seeing peaks across the board in all 3 regions of fentanyl. Oops. But in other cases, we're not. So like in October, we're seeing really high levels peak in the central region, but not in the others. So again, we're really starting to get more granular information about what's going on in certain regions of cities. And then the second piece to that I want to share with you, because I think this data hasn't been as widely done with respect as it has been for actually measuring things in wastewater. And that is what I'm broadly calling data harmonization here. And here we're trying to evaluate the relationship between, in this case, fentanyl levels in wastewater and some sort of health outcomes. In the case of fentanyl, we're looking at overdose deaths because that is the severe outcome that we're primarily concerned with. But we're also interested in looking at it in the context of other early warning measures, such as social media chatter. So we've been doing a lot of work through Induce on looking at Reddit to try to get a handle on new drugs as they emerge, 911 calls, rapid street reporting, and so forth. And that the idea here is if we can understand the relationship about what we're seeing in wastewater with the health outcomes, that we can develop predictive models and have a better understanding of what it means when we see a spike in wastewater as to what we might anticipate what the community health effects will be. And we hope that that leads to better and maybe more rapid community level interventions. And so this is just one piece of data that we've generated. And so this is just for one of the cities that had the 3 regions, central, north, and southern regions. We did a whole series of regression analyses looking at the relationship between the number of fatal overdoses involving fentanyl, which is on the y-axis, and then the levels of fentanyl that we found in wastewater based on the consumption rates. And if we actually do that analysis and we do it by site, the three catchment areas, central, north, and southern, you can see that there's a pretty strong positive relationship that's occurring here. And then further analysis showed that incident rate ratios revealed the highest levels of fentanyl are associated with an 195% increase in fatality rates. So what we're trying to do with this data, again, is sort of defining, what levels of fentanyl are we really concerned, and then what levels will be associated with what percent increase in fatality moving forward. So it's sort of a way to try to forecast what will happen in communities. Of course, fentanyl's here and it's already a big problem, but really the idea is to try to catch emerging drugs as they are just coming on the scene in a community. And that gives us more time and focus to put into rapid interventions to sort of keep us from getting to the space we are in now with fentanyl. We were able to then set up some data dissemination. So using dashboards. So we're partnering with GoAgua, which is an engineering company. And one really neat thing that they do is they actually use the sewer networks to anchor a lot of the data. And so define the catchment areas and the population that the wastewater treatment plant services. So they are able to overlay all sorts of demographics and clinics and hospitals and other data as we get it, and they can update this in real time so that the data can be disseminated rapidly. So the last thing I'm going to mention, so I'm going to switch to pesticides. This is my only slide on this because this is a study that is really ongoing, and so I don't have enough solid data to share yet at this point, but just to give you an idea of another application of how we're thinking about using this technology, and that is for tracking pesticides in rural communities. So we're working with Immokalee, Florida, for this study in Collier County that has a population of about 25,000. It's a heavy agricultural region. They grow a lot of the nation's tomatoes in this region, and the people that do a lot of that work are seasonal and migrant farm workers, so that there's a large population of those workers in this region. Florida growers use a lot of pesticides, and there has been over time a lot of interest in certain health outcomes of folks in these communities and the potential of pesticides as an exposure, but not a lot of concrete data there yet for that. And so we thought, well, maybe we can try to monitor pesticides in wastewater to try to get an understanding of how much is circulating in the community, and then maybe backtrack and understand, what exposure levels might be. So we are far from being able to do that, but that is a goal. And so right now we're looking at measuring 3 different pesticides in wastewater. And so we're actually working on the chemistry to get those assays up and going. But we have been collecting wastewater weekly from Immokalee for over a year. So we are in the process of working through that data, and I think we'll have a nice data set to take a look at once we get those completed. But again, here just showcasing another application of wastewater-based epidemiology that may be a useful tool to evaluate and better understand health in rural communities. So I want to wrap up here by just talking about some of the things we and others have learned now that we've implemented WBE in several capacities, sort of developed these frameworks, but there's still some work that needs to be done to make these really effective for what they're designed to do. One of the challenges that we have in this space is having a really good understanding of who is contributing to the wastewater streams. So in the case of fentanyl, for example, fentanyl is actually used in hospitals. And so when you're looking at regions of cities or the entire cities that are large, you don't really have a sense necessarily of where the fentanyl is coming from. I mean, and that's sort of one of the challenges of looking at large communities based on one sample, right? So while we think input in large US cities of hospital waste is fairly small, it still does contribute. And so there's questions about how much does it contribute? And so there needs to be some work in that area. More granular sampling might help this. And so that's something we're working on, trying to isolate hospital sewer networks potentially from other areas of the city. And so that's one strategy that we're working on now with one of the cities. Another challenge that we have is how to target molecules behave in wastewater. And so what you're doing is you're taking a measurement and you're making a calculation of, say, fentanyl consumption rate. But if a lot of that compound is degraded along the way in wastewater, then it may not be a real accurate reflection of what's going on in the community. So having a better understanding of how those molecules behave in wastewater, I think, is critical in understanding what the levels actually mean from a health standpoint. Wastewater is full of all sorts of stuff. I will tell you, when we get these samples shipped to us, they are black. And so they have bacteria and other things that can also degrade or metabolize targets that you might be interested in. And so again, understanding that, I think, is something really important, and more research needs to be done in that space. Harmonization of wastewater data with health data. There really hasn't been a ton of that work done with sophisticated statistics to really be able to forecast and understand what the levels mean in the context of health and how we might respond to those levels. So more work in that area. Something that has really come up in our work and with others is this idea of risk communication. And so there's a lot of concern about how we disseminate this type of data, especially in the context of like opioids or even pesticide exposure to farm worker communities, that there's hesitancy from cities and sometimes the wastewater treatment plants to allow the data to be disseminated in its full form. And so that has been starting to emerge, in that we need more risk communication done in the context of wastewater-based epidemiology. And also that starts to bring in the idea of bioethics, which has now emerged as a concern with this as well. And so you can imagine getting really granular in sampling for opioids, and you have agencies like law enforcement agencies that become very interested in that. And so how granular is too granular? And so there's a lot of questions and concerns surrounding that area as well. And then lastly, wastewater-based epidemiology really has yet to be largely tested with community interventions. We did see some of it with SARS, where we were able, in our case, to do messaging, or in other communities, they were able to implement masking or other types of interventions related to community safety and decreasing the transmission of SARS. But it really hasn't been implemented on as a large scale research study to show how well it can actually provide data in a timely manner, and that something can actually be done about it to reduce it, right? And so we've been talking to a lot of folks in the opioid space about getting some studies off the ground to try to actually evaluate this more deeply. So these are some of the challenges, and I think there's a lot of space for improvement, but I think overall it can be a really incredible tool if it's used correctly, and really within a suite of other types of early warning indicators to help protect community health. So I'm gonna stop there. I just like to acknowledge all of the collaborators. I couldn't get everybody's name here, but certainly Joe Basisi was instrumental in much of this work. All the folks at the Induced Coordinating Center. We have a ton of partners in the cities that we've been working with the wastewater districts, and also folks there in the Department of Health. And then GoAgua, who is the engineering company that is working with us on the dissemination and dashboard, data dashboard visualization tools. So thanks so much, and I'm happy to take questions.
Well, thank you so much, Dr. Sabo-Attwood, for that wonderful presentation. Yeah, as was already mentioned, at this time, if you want to type in any questions, you can use the chat, you can use the Q&A feature. Feel free to type in any comments or questions, things you want to add. We'll give everyone a minute to kind of gather your thoughts and put those questions in. There was one question which I think you kind of already addressed this, but I'll go ahead and read it. How granular is too granular? What does WBE start to, when does WBE start to invade privacy rights?
Yeah, I touched on it a little bit, and it's definitely a concern. I think it's particularly in the illicit drug space, because law enforcement also sees this as a valuable tool for trying to narrow down where there's high use of illicit drugs in communities. And so it has sparked a lot of discussion about how do we try to define what is too granular. Who owns information about what gets excreted in wastewater? So I think, it's sort of an example of a really amazing tool, but, we're using it, but maybe we haven't thought through all of the pieces of it, and so I think it's important that we do. So I think both the communication dissemination pieces and the bioethics pieces are really important spaces. And a lot of people are now talking about this. So I don't know how granular is too granular, but we're going to have to try to answer that at some point, I think, as this moves forward.
Great, thank you. So once again, if you have any questions, you can type those in. One thing that I was thinking, oh, hold on, we do have a question that I will go ahead and read. If you wanted to separate the hospitals out of the fentanyl totals, 90,213, could you sample at the hospital and back that value out of the total for a particular WWP?
Yeah. Perhaps is how I'm going to answer that. Yeah. So we could. So there's a lot of ways that people are thinking about approaching this. One is, yes, trying to do some level of sampling that either includes or does not include that in some way in the sewer networks. So we could sort of get a sense of how much input is being fed into the sewer networks. Other ways that people are trying to get a handle on this is looking at the amount that's actually prescribed to people in hospitals for procedures, say. And so hospitals do have records of that. So trying to maybe do it that way as well, or a combination of both. What that wouldn't account for per se is the fentanyl that might get into the system that's not metabolized because nobody took the compound, but it just gets dumped into the system. So one thing I didn't talk about in too much detail, I guess, is that I mentioned we measured fentanyl and norfentanyl. When a person takes fentanyl, the majority of that drug is turned into norfentanyl. And so what gets excreted into the wastewater streams is norfentanyl. We tend to base our consumption rates on norfentanyl and not fentanyl for that reason. So we're one of the few groups that has moved to using norfentanyl instead of fentanyl. So in that way, it gives us a little bit more, I think, of an accurate measure, because we're not accounting for other sources of fentanyl that's not metabolized because nobody took it, that's being dumped into the systems. But in hospital systems, you are going to have people taking it because it's prescribed, right? And so in that case, you would have norfentanyl being put into the system. So I think there's a couple ways people are approaching it. Yes, one is one of the ways that was just suggested, and other is through maybe prescriptions. So those are things that we're looking at, but it's a complicated problem because you'll get fentanyl from other sources as well, not just hospitals. I think the question is, do we need to know the exact amounts? Probably not exactly, but we have to have a sense for hospitals add 0.1% or they add 25%, and that's a bigger issue, right?
Yeah, and then next question is actually very similar, except with a different compound. Can you separate pesticide concentration from human waste versus dumping into the system?
Yeah, so we're gonna have it's all the same challenge. Yes. So the way around that is to measure metabolites, of what people produce when they consume it. And in some cases, metabolites are differently produced in humans compared to like animals, say, for example, because some of these drugs end up being veterinary drugs. But so that's one way to do that. Like cocaine, for example, has a good metabolite that we can look at, that's specific to people. But when you don't have that, it certainly becomes a lot more tricky. And so, that's one of the things that's really going to be a challenge for us with the pesticide study, is trying to differentiate, runoff from, what's getting input from people actually being directly exposed. Metabolites is one potential way to do that.
And then next, what is the possibility of the drugs traces coming into the system via drinking water first?
They shouldn't be in drinking water. So that's actually like a thought that a lot of people have, and wastewater streams are completely separate from drinking water streams. So just because we're detecting stuff in wastewater really has nothing to do with us detecting it in drinking water. So those two things should not be connected. I think if I'm understanding the question correctly. And we are also not testing treated wastewater either. So this is just the influent that comes in to the wastewater treatment plant before anything is done to it. So we fully expect everything to be present there, and we're not looking at treated wastewater and saying, oh, these drugs are all making it through, some treatment process. So we're just interested in trying to understand really what's in the community. And sometimes, like with the campus study, we were sampling way before it gets to wastewater treatment, which is literally like sewage pipes coming out of buildings. So there's no connection to drinking water with the wastewater.
Yeah, I guess just furthermore on that, yeah, you do see, for instance, on like water filtration cartridges, they say they filter out, certain pharmaceuticals and things like that.
Yes.
So I could see how, yeah, for sure that would be a concern. But I would guess the concentrations would be so low that it wouldn't necessarily impact the numbers you're reading.
Yeah, and most of the time we're not treating wastewater and then using that water for drinking water. So what we're doing with wastewater is we're like ejecting it back into the, aquifer, or, so, but can there be runoff of drugs that get into drinking water? That could happen, but that's not really where we're testing the wastewater in this case.